Dr. Polynice. I'm super excited to be having us today chatting in this conversation.
So excited to be here.
Yeah, so we're talking about why we developed the Beverly Hills Face and Body Specialist Group here in Beverly Hills, dedicated to super specialist procedures. You and I both have chosen in our careers to specialize. You in breast and body surgery, me in rhinoplasty, specifically closed rhinoplasty. And as we're building our team out with our nurses, with our other surgeons joining board soon, doing their specialty procedures, we are creating this super team of just super specialists within the field of plastic surgery.
Yeah, I mean, that's exciting. And to me, that's the future, because we all want to get better at our craft. And the only way you can do that is when you really focus on one thing and you're passionate about it. And I knew very early on that I didn't want, I wanted to focus on breast and body work. I've done facelifts, I've done rhinoplasties, but, my true passion was breast and body work. So I had a question for you.
Yeah.
So, it's one thing to say rhinoplasty, but your specific approach as far as closed scarless rhinoplasty,
Mm-hmm.
I mean, tell me how you really focus on that niche, and when did you know that that was the way you wanted to go?
So I always had this kind of concept that I wanted to be really good at something. Even when I was younger, you'd play like 10 different sports and I was always better at one. And so I felt like I just wanted to lean into whatever I was good at. Some people always want to focus on what their weaknesses are. I've never been that guy. I always want to focus on whatever my strength is and I ignore my weaknesses. And so my strength is where I always kind of pulled myself. And so even when I was in medical school, I initially thought I was going to be an orthopedic surgeon. That was my goal. Yeah, 100% I was going to be an ortho guy. I wanted the cut off sleeves and I wanted the whole, And then I realized at some point that I just felt like it was a little too different for my core intrinsic value because I do like the artistry that I'm now in with rhinoplasty and plastic surgery. And so I felt like there was something artistic missing in the orthopedics world, which again, God bless them, amazing surgeons, a lot of my friends and colleagues. But for me, I found plastic surgery to be my niche. And then honestly, I fell into rhinoplasty as the choice because of two things. One, I love the human face and I love the idea that the nose really is not meant to be a beautiful object. It's meant to be a calm, demure object that doesn't take away from your cheeks, your eyes, your lips. And so I noticed a lot of people's noses, when they're too strong, it's not that their nose is bad, it's that it's too strong for their face. And by underpowering it and just putting it back into proportion, they look so much prettier sometimes without doing anything fake to them. And the second thing was I fell into the world's greatest mentorship. I had a mentor who was the king of rhinoplasty for the past 40 years, Dr. Raj Kanodia at Beverly Hills, who I learned and trained under, taught me everything I know. So I think for me, it was the tutelage of an amazing mentor, me being good at knowing how to be a good mentee, which I think a lot of people think the key is finding a good mentor. The key is not just a mentor, it's about being a good mentee to that mentor, right? And you've obviously been a good mentee in your life many times to be able to be where you are today. Yeah. But for me, it was mentorship and then wanting to really super specialize in one specific thing. And so to your journey then, how did you, as a plastic surgeon who obviously trained in everything, how did you decide that you wanted to focus on just breast and body?
Right. Well, again, it's sort of the same thing. As you go along, you kind of, it's like when you have surgery booked for a certain day and then you wake up excited because you're going to do a certain thing. And then other times you wake up and you're like, so I already knew that my focus really wasn't on the face. I mean, I really was passionate about breast and body work and the total transformations. And in my training, I did full general surgery and then I did critical care surgery. So I was really used to dealing with complex problems and big cases. So in the beginning of my career, when I started plastics, I did a lot of reconstruction, breast reconstruction following mastectomy, cancer reconstruction, trauma. I did burn fellowships, so I did a lot of burn reconstruction. I did massive ventral hernia repairs. Wow. So that was my thing going on. So I did a lot of big body transformations. So that was kind of the thing that really got me excited when I can look at a person with a lot of different issues with weight loss, excess skin, stretch marks, and really create this sort of mold, this transformative procedure. It was just amazing to me to be able to do that. And I found that those people were very, very appreciative and very. It's funny because you specialize in the face and the nose, right? Mm-hmm. And here's the big difference to me: like you can't hide your face. You're always walking around showing your face. So people are used to that, but people aren't used to showing their bodies. Usually, you hide your body. You're all covered in clothes or anything. So it's easy to hide that. So getting somebody to shift from that to wanting to expose their body or being proud of that or being eager to show that. It's transformative.
Right, because you see a behavioral change. It's not just about the procedure. It's about you seeing an entire lifestyle change.
Entire lifestyle change. And I'll give you a quick story. I would do seminars at my office talking about different procedures. And one time, this one woman, she was in her late 60s, and she'd lost a lot of weight. So she had a lot of loose skin. And I did a tummy tuck liposuction on her. But here's the interesting part. She'd been married for over 40 years. And she was always overweight. Even with kids and weight loss, she was always overweight. And she told me that her husband had never seen her with the lights on.
Oh my gosh, wow.
Ever. Until we did this surgery. Not only did that change, but then she came to one of my seminars and in front of 20 people showed off her tummy.
Wow.
Which she'd never done. So to me, that transformation and that empowerment and that confidence is what makes it rewarding.
Yeah, that's beautiful. Because at the end of the day, it's about the insecurities that we all have as humans, you and I even, right? But having that insecurity, then we get this amazing gift to be able to, through our super specialty, help people with their insecurity versions, whatever they are, whether it's the nose or whether it's the body. And that's what my biggest thing is about the super specialization, is for us to realize I also want to be very authentic with what I give and offer to people. I have so many plastic surgery friends, as you do too, who are literally, their menu is like Cheesecake Factory.
Yeah.
They offer nose jobs, facelifts, tummy tuck, eyelid, breast surgery, skin rejuvenation, lasering, and they do it all. That single surgeon does it all. And so to my question to them is, there's no way you're good at all this. There's just no way. Anthony Bourdain, he had a really beautiful interview with Oprah that I watched. It's an old interview. And he was talking about, Oprah was asking him the tips and tricks to dining, right? Because who would know better than Anthony Bourdain of where to eat properly? And he said, find a restaurant that's very focused, that's very prideful. They care about the result of their food and making sure it's delicious. And usually you'll find that a very small, condensed menu where they're not offering lasagna and pasta and sushi and Chinese food. And, it's just condensed. And that's what I always dreamed and envisioned for my own practice, to have this condensed version. But the problem is, I have so many patients, as you do, who after you do your niche procedure on them, they want the other procedures, or they need to ask about for their friends or their family. And then I feel bad sometimes referring them to one of the surgeons who is a cookie cutter surgeon who does 50 different procedures. And I don't really know what they're actually good at, to be honest. It was honestly confusing for me how to give referrals. And that's where Beverly Hills Breast and Body, Face and Body Specialist for me was so important, because now I know truly your expertise. You're a terrible nose surgeon, but you are a phenomenal breast and body surgeon.
That's exactly right. And, that's the key thing. You want to have the confidence to refer someone to somebody who has put the same time and effort and dedication into what they do, same way you have. Yes. And that's how you have that confidence. And that's why this is a synergistic relationship, and that's why it works so well.
Yeah, absolutely. Where did you train? Tell us about your training and where did this all start for you?
So, my journey is kind of interesting. I'm originally French, so I did a lot of training in Europe.
Oui.
So, and that's really helped me as far as communicating with patients, because I'm fluent in French and Spanish.
Well, can I just tell an anecdote? Yesterday, we had a beautiful patient from Cairo, Egypt, that I did the beautiful daughter's nose, and the mom wanted to ask some questions about some breast and body work. And when you came in the room, somehow she picked up, or you picked up, someone picked up a little French. Yeah. And then you guys ended up going to a full-on, the rest of the consult in French.
Consult in French. She was Francophile. She said she spent half her life in Paris.
Yeah.
And we just hit it off right away. I still have, my family, my brothers live in the south of France.
Wow.
So, so that's been able to really keep me in tune with, different cultures, and because everything is sometimes a little specific when people come from different backgrounds, and them being able to communicate that is key, and it also creates a real element of comfort.
Right.
So I did a lot of my training, medical school, and all that in Europe, and then I came to the States. Studied, passed all the tests, and did my general surgery in New York.
Okay.
Out in Long Island.
Yeah, hardcore.
Yeah, it was actually. I did some pretty amazing training in New York, in the Bronx, in Harlem, and in Long Island. Yeah. And then after general surgery, I did a year of burn and critical care.
Wow.
At New York Hospital.
Amazing.
For New York Presbyterian Hospital. That was pretty intense.
Yeah, that's as hardcore as it gets.
Yeah, because that's the biggest. I think it's the biggest burn unit in the country. 40 ICU beds, and just me taking care of hundreds of burn patients. It was
Wow.
crazy.
Incredible.
But treating patients like that, which were the extreme of critical care,
Extreme.
really put me in a comfortable position to really treat any kind of complex situation.
Sure.
So I did that. And then after that, I went to the Mayo Clinic in Minnesota, and that's where I did my plastic surgery.
Most prestigious.
That was an amazing
Mayo
place.
Clinic, yeah.
Amazing place.
Incredible.
And that's where I met people literally from all over the world who would visit the Mayo Clinic.
Yeah, of course.
And
the whole world.
The whole world
Dubai,
comes
Saudi.
Oh my God, I met so many
Kuwait.
people from United Arab Emirates and all over the world really who come there. And that's where I decided and put together a trip. After my training, I spent a year traveling around the world, visiting different plastic surgeons and did things that I was interested in, honing my craft, specialized.
I want to pause at that because that is so important. What you just said, you spent a year of your life. Okay. You're already a full-fledged board certified surgeon at this point.
Yeah.
You could be making money, you could be earning, you could be working somewhere. And instead you gave up a year of your life, year of revenue, year of income, just to dedicate to more knowledge so that you can give your patients a better service. It's incredible.
Because even when I was training at the Mayo Clinic, I felt that there were gaps in the knowledge in my training. And not horrible. It's just a sense that you knew that people were doing things differently elsewhere. And then you have to go figure out why they're doing that this way.
Right.
And there's certain results that I'm getting. And so to give you an example, there's a very traditional technique of breast reduction that's taught in almost every teaching institution. It's like, where do you orient your pedicle? How do you do that? And, in the States, it's mostly an inferior pedicle, mostly. Now it's changing. But in Europe and South America, it was always a supromedial pedicle. So why was that? And exploring the reasons behind that and the different techniques and visiting these different surgeons, I learned a lot of what not to do as well.
Yeah.
That's key.
So key.
And that is key. But it's fascinating. It's fascinating. I mean, I spent a month in Taiwan.
Wow.
And Taiwan, Changgung Hospital in Taipei. I think it's still the biggest hospital in the world. It has over 3,000 beds.
Wow.
300 ORs.
Yeah. Wow. Insane.
300 ORs.
You learn the art of efficiency at these kind of places. Yeah.
I remember the first time I got there. First time, and everybody, almost no one speaks English. But the 300 ORs, and the first time I got there, and I go to the OR, and there's this resident, ENT resident. He's doing, and by the way, the ENT residents, they would do the cancer resection and the reconstruction themselves.
Yes.
By themselves.
Yeah. Yeah.
So this guy is doing floor of the mouth squamous cell. He's resecting the whole thing, and he's going to be doing a double free flap to reconstruct the bone. And so I'm standing there, and he's working, and he looks up at me, and he says, he kind of just noticed I was there. He says, "Who are you?" I said, "Oh, I'm Dr. Polynice. I'm just visiting and I'm observing." He says, No, you scrub now." I said, No, I'm visiting.
Yeah.
I'm just visiting. I don't think I can scrub with you. He said, "No, you're not going to stand there and watch me. You scrub now." So I scrubbed with the guy, moved there for 14 hours.
Oh my God, that's
Helping him do a double free flap
That's incredible.
to the head and neck. It was just the most amazing.
Taiwanese government is watching. He's just lying.
No, but there were a lot of
That's
people visiting that way, and it was fantastic. So I went all through there, Australia,
Wow.
Europe, Italy, UK, Brazil, France.
Incredible.
It was amazing.
Yeah, and that's where you get that international appeal now, because I've noticed that your patients come from all over the world. And I have patients from our practice that are dying to meet you, no matter what niche of the country in the world.
Right.
Patients from India, patients from Egypt, patients from Europe, and the Middle East. And I've seen that you're able to communicate so easily, no matter what niche of the world they're from your global experience.
You're absolutely right. So, for example, if somebody wants a liposuction with a fat transfer to the buttock, a BBL,
Yeah.
and they come from South America, well, they have a certain look and a certain aesthetic that they're really going for. So you have to cater to that.
Right.
But if somebody comes from, LA or New York and they want a BBL, it's a totally different story.
Yes, yes.
Or I've had women from India who sometimes they have specifically told me, I want to wear my sari, and my tummy tuck scar needs to be in a certain position. They need to cater to that. Or somebody from Brazil wants a high-waisted bikini look, and you have to be able to cater to that. So there are a lot of different things. So it's not one cookie cutter, one thing fits everything. You have to really cater to the person, listen to what they're saying,
Right.
and really tailor the surgery to that.
No, that's gorgeous. Where I have most similarities with you is the concept of wanting to make sure whatever we do is within the patient's best interest. And that's whenever we linked up years ago now, it's always been, how do we make the patient experience the best?
Right.
Because a lot of surgeons, I'll be completely honest with you, and you know this too, a lot of plastic surgeons are just in this for the money. They just want to make as much money as possible. And I have found that that's something that I've never really been attributed to. I feel like money comes from success that's warranted, that's deserved. I think you will be given money if you are good at what you do, and people are gracious and thankful for it. But I think chasing money is a really dangerous way to create a business that's human to human. If you're pushing papers and you're doing your finance type of guy, I get it. It's a very different world. But when you are manipulating someone's body, emotions, mind, it can't be about the money. It's got to be about how you can help them to the best potential. And that's why I was so excited to work with you and team with you, is because you have that same vision. We don't care about the money. The money is secondarily. We would love it. God bless it. But that's not why we're in this. And that's not what we use our patients for. Early on, my mentor always taught me, never abuse your patients for your own personal use, right? We are a service to them, and let's be of service to them. And so when I started at my stage of figuring out I want to do rhinoplasty, I used to spend in medical school and in residency 1 week every year in New York City shadowing Dr. Norman Pastoric, who is one of the most renowned, most famous rhinoplasty surgeons in the world, especially in the 80s, 90s, and 2000s. And then here in LA, I'd spend 1 week every year with Dr. Raj Kanodia, who's one of the most famous rhinoplasty surgeons in the entire universe till today. And so I would literally give up my spring breaks and my winter breaks. Instead of going to the beach or partying with friends I would just go to New York and LA every single year for 8 years in a row, until I finally realized that this is 100% what I want to do, dedicate my life to this. And like you said, you learn so much from these mentors of what to do, what not to do. I used to also travel. I went to Miami. I went to Paris, actually, and I shadowed plastic surgeons there. I went to Seoul, Korea. I spent 2 weeks there in a hospital in Seoul, learning all the incredible ways they do double jaw surgery and the incredibly complex techniques they do there. And I had always, what I loved about the kind of resonating theme of what we're talking about is that no matter where you are in the world, if your core is to help people, truly help people, not try to make money, not try to like be the best, like non-ego driven, just purely of service, then there's a lot of similarities in how you react, how you treat, how you take care, the sympathy you have towards them. And I think that's what echoed with you and me, is that we both have that same discipline. To end of the day, we just want the best for our patient experience. Money comes, great. Money doesn't come, no problem, as long as we get to fulfill our purpose. And that's what I love about working with you and getting the chance to work with you together.
No, you're absolutely right. And that's the key thing for me. And that's one of the things that feedback I get from patients a lot is sometimes I'll see them in consultation. You know, they may have seen a few other surgeons, and they'll say that the one thing that stands out is that they truly felt heard, listened to, and that I'm not trying to push anything on them.
Mm-hmm.
Matter of fact, I say no to a lot of patients, and they're very surprised sometimes when I feel that maybe I can't fulfill their expectations or I'm not the right surgeon for them. So yeah, to that end, I had a question for you, because I know you specialize in closed rhinoplasty,
Yes.
but I'm sure some people aren't good candidates. So how do you address that issue?
Well, my biggest thing is, like you said, integrity and honesty. I want people to feel so open to come to me for a consultation, knowing that I'll guide them to whatever their best interest is, even if it's not me, right? All my other friends who do noses, it's almost guaranteed if you come in for a nose consult, they will offer you surgery. Versus me, it's very different. I'm very honest about it. I'll analyze the patient's need, see if closed rhinoplasty could benefit them. And if it truly could, then we look at the risk-benefit ratios and whether they should do it or not. And if that also works out, then fine, I'll offer them surgery. But if I truly think it's not in their best interest to get closed rhinoplasty, I think they would be better off getting no surgery. Very happy to offer that. If I think they'd be better off doing some other type of procedure, I'll tell them what that could be. Or if I truthfully feel like they need a more reconstructive approach to the nose, which is open rhinoplasty, where they make a cut at the bottom, as you know, lift up the hood of the nose, reconstruct the entire nose. Sometimes it's necessary for someone who's had traumatic deformity, revision surgery, a very altered anatomy that a little finesse won't fix. You know, some people have needs that are beyond just finessing and improving. In those patients, I always recommend them to open rhinoplasty surgeons that I trust and feel are truly, just like me, super specialists. And it goes back to the key component of what we do, trust, integrity, honesty, in how we will approach our patient consults and how we will guide them and how we'll only do what we're good at. I'm the worst breast and body surgeon in the world. and happy to admit it, right? Because I know what I'm good at, and that's the only thing I want to offer my patients. And that's why it's such an honor to work with you in collaboration with the Beverly Hills Breast and Face and Body Specialists.
Well, we have the same philosophy, and that's why this works.
Yeah. So thank you so much for today. I think this is super important just to kind of get our thoughts out together collectively. And for everyone watching, I really, really would love for them to learn more about you, Dr. Alain Polynice, and me, Dr. Deepak Dugar, and what our nurses here at Beverly Hills Face and Body Specialists do. All of us super hyper focused on our niches to give the best excellent care without ever jeopardizing the integrity, honesty, and trust that we want our patients to entrust with us.